Hi, welcome to the Milk Making Minutes. This week, I want to take a little bit of time to talk about medications and breastfeeding. This is really important because oftentimes parents get told they need to cease breastfeeding or pump and dump for the duration of the time that they are breastfeeding. And many times the research does not indicate that this is necessary. But the medical professional telling them that they need to do this is not familiar with the breastfeeding resources for advising what a nursing parent should be doing when it comes to best practices with medication. And so there are other resources that both the parent can access and medical professionals. And so I'll tell you where you can access those resources. And then I can also tell you what to look for when it comes to medications if you would like to look medications up yourself. Now, before I do that, I do want to say, of course, that this should not be your only source of information when it comes to making decisions for the medical safety of you and your baby. This is just supposed to guide you as you're trying to make these decisions. As I share these resources with you, take them into consideration, bring them to your healthcare provider to help educate them, and then make the decisions that are right for you. So let's get into it. When I began breastfeeding, I was blindsided by how difficult it was. I may have thought I was prepared, but having known only a handful of people who had ever breastfed and only seeing it up close from a couple of them, I had a huge learning curve. Since then, I've become a doula, a lactation consultant, and a childbirth educator. I'm your host, Lo Nigrosh, and I welcome you to the Milk Making Minutes, where we explore breastfeeding experiences through the lens of systemic barriers so that you know your breastfeeding struggles are not your fault and your triumphs really are the miracles you feel they are. Okay, so why is this important? Many times, breastfeeding parents, nursing parents, they have a routine dental procedure. They need to go on some sort of antibiotic. They have some sort of procedure that might not be routine. And they tell the provider that they are nursing, and the provider says, oh, you need to pump and dump, or, oh, you need to wean before we are able to do that. And then the parent is faced with the decision, should I put my health and safety first, or should I put the health and safety of my baby first? And this is a really unfair decision to put before a parent when they don't have to. So Dr. Hale is a professor of pediatrics and Associate Dean of Research at Texas Tech University Health Sciences Center, and he's the acting executive director of the Infant Risk Center. He is considered one of the foremost experts in the field of perinatal pharmacology and the use of medications by pregnant and breastfeeding mothers. And so he created the website infant.For, and he also created a warm line that you can call, and it's run by medical practitioners like nurses who will be able to look up any medication that you have a question about, and they can give you a drug classification so that you can decide for yourself whether or not you would like to continue breastfeeding. He also wrote a book called Hale's Medication and Mother's Milk, and it is considered the best resource for looking up drug safety based on what the research tells us about the safety for the infant when a mother needs to take a medication. So if you have a question about whether or not your breast milk could pass on a drug to your baby through the breast milk, then the two resources that I recommend that you use are the infant risk warm line, which you can call 1-806-352-2519. I'll have that in the show notes. They're open usually Monday through Friday, business hours in the Central Time Zone. Or you can look up the LactMed database. That is the National Institute of Health Library of Medicine website. They have a database where you can search for a drug, and it tells you whether or not research studies have shown that drug to be safe for a nursing parent to take. So those are the two resources that most lactation professionals use when they're guiding parents about how to talk to their medical provider about the safety of a medication. Most medications are safe for breastfeeding. So I'll just start by saying that. Most of the time, you can continue breastfeeding. Dr. Hale created a drug classification system based on the safety of a drug and whether or not it can pass to the infant. And that drug classification goes from L1, meaning safest, to L5, meaning contraindicated. So L1, if a drug is classified as L1, it means that the drug has been taken by large numbers of nursing parents. There have been controlled studies that have found no adverse effects. The risk to the baby is very remote, or due to the characteristics of the drug, it is not orally bioavailable to the baby, meaning that there is no way that the baby's body can process that drug and have it affect their body. And I'll go over that in just a second. L2 means that it's safer. There might be some studies that exist around the drug in nursing parents, but we know that nursing parents have taken them and there have been no adverse effects. The risk to the baby is very remote. L3 means moderately safe. These are newer drugs or drugs with no published research or no controlled studies. There's a possible risk, but studies have found minimal effects on the baby. And generally, if a drug is classified as L3, we still recommend that breastfeeding continue because the risks to the baby are still lower than the risks of cessation of breastfeeding. L4 means that it's possibly hazardous. Evidence of risks exist to either baby or milk production. If there are no alternative drugs available and the parent is seriously ill, the benefits may outweigh the risks while continuing to nurse, but again, this is something that every parent needs to decide for themselves. And then L5 means that it is completely contraindicated, that the drug should not be taken during lactation. Either studies have found significant risk to the human milk-fed baby, or the characteristics of the drug indicate the risks to the baby would outweigh the benefits to the parent. So that's that drug classification that you can use to determine whether or not a drug is safe while breastfeeding. Do you love to read about pregnancy, childbirth, and breastfeeding? Are you looking for books to help you become a more confident parent? Or perhaps books to help you understand what went wrong with your breastfeeding journey or to do better next time with breastfeeding? Or do your kids have questions about breastfeeding or pregnancy, but you don't really know how to answer them? Would you prefer to have a curated list on these topics? Go to the link in the show notes to my new affiliated bookshop. Every purchase you make benefits the Milk Making Minutes. But better than that, these books are vetted. I've read them all, and I feel very confident recommending them to you. I'll be adding to them continuously, so go to that link when you want to purchase a book. It will help the show, and you can feel confident it will be a purchase you will enjoy. And so here's how we make that classification. There are several characteristics of a drug that researchers look at when they are trying to determine these classifications. They're looking at concentrations in the maternal plasma, the molecular weight of the drug, the protein binding of the drug, the lipid solubility of the drug, and the pKa of the drug, whether or not it's balanced in the pH, and whether or not it passes into the brain easily. So here's what we know. If a drug has a low concentration of maternal plasma, meaning it has a low drug to plasma ratio, then we know that the drug is safe for the mother to take. Dr. Hale says this on his infant risk website. Drugs both enter milk and in most cases exit milk as a function of the mother's plasma level. As soon as the maternal plasma level of a medication has fallen, the milk level soon follows. Because the maternal plasma level of the medication is such a major determinant in the amount of medication transferred to milk, many drug delivery systems that deliver only exceedingly small levels to the plasma are preferred in breastfeeding mothers. So that's one of the first indicators that researchers look at to see how to recommend a drug. The next thing is the molecular weight of the drug. So drugs that have a high molecular weight cannot cross into the alveolar epithelial cells where the milk is made. So the higher the molecular weight, the better. So when you're going on LactMed, for instance, and you're trying to determine the characteristics of a drug and whether or not it's safe for your baby, you can look at the molecular weight and it will usually tell you there. And drugs that have high molecular weights are safe. Drugs that have low molecular weights are not safe. Usually anything less than 300 are considered small enough to penetrate the milk. Anything higher than a molecular weight of 600 cannot penetrate human milk. Okay, so then we look at protein binding of the drug. If it has a high protein binding, it is safer. That is because human milk has a lot of fat, which are lipids, and very little protein. So if the drug binds to a protein, it will do so in the maternal plasma and it won't enter the milk. Now, if the drug is extremely lipid soluble, it will pass into the milk more easily because human milk has a lot of fat or lipids. So you're looking for high protein binding and low lipid solubility. And then we're looking at the oral bioavailability of the drug. This means, is the drug absorbed once it enters the GI tract of the infant? If it does get into the milk. So if the drug has no oral bioavailability, even if it does enter the milk, there is no way it can be absorbed into the GI tract of the infant. And therefore, it will have no impact on the infant and it will be denatured by the acid in the infant's stomach. So when you're looking at the drug characteristics in LactMed, or if you're just Googling it and you see that it has no oral bioavailability, then there is no risk to the infant. And then finally, the pKa of the milk. pKa of a drug is the pH at which the drug is equally ionic and non-ionic. The more ionic a drug is, the less capable it is of transferring from the milk compartment to the maternal plasma compartment. Hence, they become trapped in milk, ion trapping. So you want to choose drugs with a lower pKa because then they will not get trapped in the milk. Okay, so I hope that this has been helpful for you as you seek to determine whether or not you would like to take a drug that has been prescribed to you. And also, this is meant to be used as a starting off place for your care providers. You know, I do a lot of talking about how care providers just aren't educated on breastfeeding. So if this has been helpful to you, make sure you share it with somebody who could use this reference so that they can make decisions for their family, not based on fear, but based on facts.